Now, there's a big story here in the Standard today. Pain of patients left on their own as doctors stand their ground. And there's a photo there of medics who were demonstrating yesterday. They went to Afia House. They also went to Parliament. One of the people in the photo is the Secretary General of the KMPDU, Dr. Davji Atela. The other one is our guest for the next hour, the National Chairman of the Union of Clinical Officers, Peterson Wachira. Good morning.
Good morning.
How are you doing?
I'm very well.
You are very well.
Yes, and
many Kenyans are not
personally,
very well.
And thanks a lot for inviting me here. Again, I must say that it's always a pleasure and a privilege because this is one of the places, this is the real bunge ya mwananchi.
Kabisa.
This is where civic education happens. It is the place where Kenyans get to understand more. And I also want to wish my Muslim brothers and sisters Eid Mubarak.
Karibu sana.
Asante.
City is away. City has told me that the proverbs for this week are from the Kingdom of Morocco. Listen to today's proverb, Peterson. The ones who fear live. Live, L-I-V-E, not leave. The ones who fear live.
You know where I come from in the union, the ones who fear leave, but the leave is for the other one, L-E-A-V-E. But I think what it means, it is similar to a saying in my local dialect, Kaguayaka ino kagira nyina, which basically means
I told you that's a Moroccan dialect.
That's what you said before. Okay. Kago what?
Tell it.
Kaguayaka ino kagira nyina.
Sawa.
Which basically means that sometimes wisdom is in fearing and pulling back, probably. And sometimes you need to have the courage to show that you fear. You know, sometimes people fear to show that they fear.
Yeah.
Yes, and sometimes it saves.
True.
I think that is what it means. But where I come from, fear is not allowed. Yes.
It's not allowed.
It's not allowed.
Basically, actually, even in that dialect, probably what they were saying is, because direct translation is the coward goes back to his mother. Right?
Yeah.
So if you're a coward and maybe you've gone to battle with a group of the other warriors, you've gone to battle, you're a coward, you'll go back to your mother's house. The others have gone to battle.
Yeah.
They will come back with livestock that they've stolen from the other side. They'll start their life. They will not be going back to their mother's hut. You see that? So it's actually now saying, no, do not be.
Do not be afraid.
On the other side, it can also mean that actually the aggressive and the courageous will be in the front line and they are likely to die.
They'll die in battle.
But the one who is fearful and takes a back seat is probably might go back to their mother. So it can mean either way.
Sure.
Can be either of the two. Peterson, the clinical officers joined the doctor strike.
No, we did not join the doctor strike.
What happened?
We went on strike. And today we are doing 10th day of strike. And, we came together as the Health Union Caucus, where I chair, and we did a petition on 4th of March, jointly, as all the unions in the health sector. We wrote to the Ministry of Health, to the Council of Governors, to the Treasury, to the Office of the President, everybody who matters. And we said, look, the issue is here. And we are giving you 14 days to resolve these issues, or at least give us a pathway that will lead us to resolution of these issues. But 14 days then, they didn't do anything. The doctors started their strike. We said as clinical officers, and we actually said publicly that please do not force us into a strike. We don't want to go on a strike. So the doctors started, and we said, let's give them another 1 week. So we actually gave the government 1 week.
An extension to the notice.
Okay. And we announced publicly. Then after the 14 days, after the 7 days, which is now 14 days from the date we submitted our petition, they didn't do anything. And now we gave a strike notice for 7 days. So we actually started this journey together. We, as all the healthcare workers. It's only that probably the notices we gave at different times, but we all had different issues. And when it comes to us as clinical officers, our strike is protected. Have you seen any order from court? I know some governors who have went to court. Mudhomi Njoki from Tharaka-Nithi, who is the chair of the health committee, went to court. He was denied orders to get us back to work, and he withdrew the case yesterday. Because the governors are actually in contempt of court.
Yeah.
There is an order that directed them to come to the table and conclude the matter in a case where they had sued us themselves. But now they defied. And I'm wondering, I saw yesterday the CS for Interior is now banning demonstrations for KMPDU, like it's a proscribed sect. And I'm wondering, so what should we do to the governors? Do we also ban them from performing their duties now that they're also in contempt? Why does the law apply on one side and not on the other?
Let's look at the intrigues of what this particular case that the clinical officers are then bringing forward. What are the issues that are contentious now that then there is a contempt of court issue at hand?
We have, in our demands, we have 10 issues.
Okay.
Number one, and by the way, we have no new demand.
Okay, same as they were before.
We have no new demand.
All right.
The enhancement of the risk allowance that we're asking for is not something that we are demanding that now we want them to give us. It is something we agreed. We have an agreement from the first day of January 2021 when people were celebrating the new year. Myself and my team, we were with CS Kagwe in the office, concluding that negotiation, and that negotiation was conducted under an interministerial committee that was actually put together by the president during the COVID-19 when we went on strike, because we didn't have the protective gear. So we are basically saying, we agreed. Why haven't you been implementing? Can you implement? The second item is the collective bargaining agreement. We started from 2019. We have gone through the whole legal framework and the structure that provides for what should be done. Until the point now you can go on a protected strike. We negotiated, we ran into a dispute. We reported to the Ministry of Labour. A conciliation team of 3 people was put together. The conciliation failed. Why? The governors refused to come to conciliation. Then we went on strike, and they took us to court. They were given orders, we were told to go back to work. We agreed and went back to court. But then the same court told them, can you go and sit with these people? And they defied. And that is why we are on strike, because we have not been able to conclude the CBA. But it's good that for the Ministry of Health, they actually complied. And we have been negotiating with a team headed by the PS, Mudhomi, the PS for Public Health and Professional Standards. And we're almost at the tail end of concluding that CBA. The other thing is about career progression guidelines. This was in the agreement of 2017. But then the Public Service Commission decided we will no longer approve schemes of service. Now we want to shift to career progression guidelines. They refused to approve. So since 2018, we haven't had an updated scheme of service.
What does that mean?
Why?
A scheme of service provides for the grading and how you climb the ladder of
How
the
you get
profession.
promoted.
Yes,
How you get promoted.
how you get promoted.
Okay.
And with the experience, and as you gain qualifications, as you become more qualified in terms of skill sets. So now we decided, why don't we then comply? Because we went up to the Senate. Senate gave PSC 2 weeks and they still defied. So we said, now that they don't seem to listen to anybody, let us just convert our scheme into career progression guidelines. We did that early last year. But then it has been lying there, pull and push. Sometimes we are told, no, we need to sit and you explain to us. Then another team comes and tells you, no, we are new. We need to go to Naivasha and you tell us 1 or 2. And so that is another issue.
So are you saying that in this period, no clinical officer has been promoted?
They were being promoted using a scheme of service of 2014.
Okay.
But we were supposed to have a scheme of service of 2020, which actually should have been utilized because the Ministry of Public Service had directed that you can actually utilize that. But the counties refused.
Okay.
Okay.
Another issue?
So another issue is the universal healthcare contract. You know, myself, I'm a beneficiary. The work that I do for the ministry, I got it because of the fight for Ebola in West Africa. Where I led a contingent of Kenyans. And when we came back, the president appreciated and said, those who are not civil servants, give them jobs. We were appreciated. Now, when we have a team of universal healthcare staff, the COVID-19 emergency response program staff, and the others who are employed during that time, why can't we appreciate our own? Why can't they be accorded the same appreciation that we were accorded? These guys are running half pay. They're being paid half of what their peers on PNP are being paid. They're probably even doing more. We are working together in the same rota, the same hours. You have the same qualification. Some of them actually succumbed to COVID-19. And the other day I heard one of the governors saying that, but we did them a favor, we gave them a contract, and now it ended, they should go home. And I think that is the contempt of the highest order. We must create a tradition in this country to reward, and especially those people who put themselves forth with courage, especially at times when nobody else can actually be able to go out. Because the opposite of that then would mean that when we get into that scenario again, that situation again, who will be willing to come out if then you're going to be treated with contempt later after you have sacrificed yourself? So that's about the UHC and basically the contracts. We are saying we should not actually have contracts in the public service. And the problem with the universal health coverage and the issue surrounding it is again the governors. The Ministry of Health has said we have a budget to put them on PNP. We only have a small shortage which probably the Treasury can be able to help us with. But then the Council of Governors keeps insisting that there was a decision of summit for them to do 3 years. And they should complete another 3 years, which would make it 6 years. Before now they can be absorbed on permanent and pensionable establishment. And we're asking, if people are working for your people under the counties, why would you really want somebody to continue on half pay? They are disadvantaged. As I get an annual increment every year as a civil servant. I get promoted. They cannot for 6 years. Their peers who they probably entered together into the civil service 6 years ago or 4 years ago, they have been promoted twice, because you enter after 1 year, you go into the next job group. After 3 years, you go into the next job group. So if somebody entered at K, by the time these guys are done with their contracts and then they are going to be on PNP, that person is going to be where? At M. So they are disadvantaged. And that is why we are saying that this is an issue that can no longer wait. The other issue is about the Kirinyaga, where the governor and the county public service board decided to dismiss everybody because they went on strike. But then the Public Service Commission, which is mandated by law, because the law says, the County Government Act says, that if you are aggrieved by a decision of the County Public Service Board, you appeal to the PSC, and then their resolution will be binding upon that County Public Service Board. And the Public Service Commission gave a directive: reinstate these people because they were not dismissed in the proper way that should happen. But then that has not happened, I think, more than 2 years now. So and we are saying they have to be taken back.
They have not been reinstated.
They have not been reinstated. So the other issue is about the interns. And there is a lot of confusion on who an intern is. I never thought probably an intern was something that is as confusing as I am saying. But probably I can explain to them today.
Yes.
Number one, an intern is not a student. For you to go for internship, let me give just an example of myself. I went to Egerton. I finished.
How many years?
Graduated. After graduation, I got my certificate and I went to my internship center. I actually had a certificate. I had qualified. It's not that I was not qualified.
You had
the
a
only
degree.
reason, yes, the only reason we do internship is because human beings are not like machines. If it's for this machine, I can probably, after you qualify, you can test with it. Probably you can make some mistakes. The worst that will happen, you're going to spoil the machine. But for human being, there are no second chances. So we want you to work under an experienced clinician for a whole year, so that by the time we are releasing you to go and see patients independently, then we are confident that you are not going to kill or harm that patient. That is the essence, and that is why you only get your license after you graduate and do a 1-year internship. So they are not
this
students.
Applies to doctors
Yes.
who do the doctor's degree, and it also applies to clinicians who do the clinical officer's degree.
And diploma.
And diploma as well.
Yes.
It also applies to nurses
Who do degree.
who do nursing degree.
Yes.
All of you must do 1 year postgraduate internship
Very true.
before you then get a license to operate
Very true.
as a clinical officer.
Yes.
So what's the issue?
Now the issue is the Public Service Commission gave an establishment with a structure, and it actually said that for clinical officers diploma, they are going to be paid at job group H. For degree, a job group K. And so on and so forth for the nurses and the doctors. But then, the other day we see some figures that we don't know where they came from the SRC, saying that this is what should be paid for to these people. And then we wonder, because the body that is mandated to give out that structure is the PSC. And the Salaries and Remuneration Commission can only advise in line with an established structure. So you wondered, where did they get the figures from? How did they determine that a clinical officer diploma should get 35 instead of 75 that the Public Service Commission provided for? Or a degree should get 50 instead of 115? So what we would have expected of the Salaries and Remuneration Commission is for them to go down to the facilities to carry out a job evaluation, come and tell us, according to the job that these people do, because they are the workers. They are the ones that offer around 40% of the services because of the shortage that we have. And you could say the governor is asking for them when they were not posted because there was that gap. If they did an evaluation and then told us, let's have a conversation, we have done an evaluation and this is what they do, this is what we think the compensation should be, that would have made sense. But now, you cannot just give abstract figures out of nowhere.
I'm curious as to then what was the response when you have, all of these issues have been on the table. Like you said, they're not new issues. There's a contempt of court issue as well. So
Yes.
obviously it is something that was agreed upon and there was no compliance.
True.
So when you said, well, can we now get some of these things in order? And we're giving you 7 days or however many days. What was the response? Or was there silence? Or how did this work out?
The ministry responded after we went on strike.
Okay.
But they have done very well. There has been a lot of goodwill. The Council of Governors didn't. In fact, up to today, we don't have any response. But of course, we demonstrated to that place the other day and yesterday, and you'll note my voice is a bit hoarse because of that.
You were shouting.
Yes. And what we expect of them is to comply to the court order.
Okay.
And we had a moment to engage with the chair of the HR committee in the Council of Governors, His Excellency Mutahi Kahiga, who said that they're actually working on that to bring a team to the table. But that is what the court had asked. In fact, if that was done when we had given our petition 14 days, that is more than a month ago, we wouldn't be on strike. Because, as I said again, it is not, we do not derive any pressure from going on strikes. We cannot spend so many years in medical school spending sleepless nights trying to understand a human body for us to sit down and watch people suffer. But sometimes there is also the principle of do no harm in ethics. And sometimes we do more harm by being in those facilities than when we come out and ask for things that would actually later help a Kenyan. And let me just explain about that, because sometimes Kenyans think that we are political and we just look after ourselves. I like giving an example of a sore throat. A sore throat to any Kenyan is just another mild illness.
Kahoma kidogo.
Kahoma kidogo tu. But a sore throat, some years to come, can lead to a mortality when nobody will suspect it was. When you get a pharyngitis, that is a sore throat or the tonsillitis, it can lead to another disease we call rheumatic heart disease. It may not be as severe when you are young. It may actually resolve, but it may also injure your valve in the heart. If then that's a lady, if it's a girl, when they become pregnant, they can actually get that cardiac disease in pregnancy. And some succumb to it. But nobody will know that the mortality at that point is because of 20 years ago that there was no clinic officer in that facility. They went there, they waited for 8 hours, they got tired, they went home, probably passed by a chemist, got some painkillers, thought that it had resolved, and never came back. And these are the things we are saying. When we ask, because one of the demands is, can you please comply with your own plan, employ the 20,000 health workers, and we plan how to employ on an annual basis. When we're asking for that, we have that at the back of our minds. We have the issue of the waiting times for the patients, the complications that come with it, the consequences to the general public. And so we must be the advocates of that patient, because they don't have the information that we are privileged to have. They will not know what we know. And probably it may be hard for us to understand, for us to make them understand. And that is why we fight on their behalf. That is why sometimes we say, please let us give it a pause. Let us go and try and fight and see if we can make it better, so that then we can look after you in a better manner.
Let's take a break. We'll continue this conversation shortly. Peterson Wachira is the national chairman of the Kenya Union of Clinical Officers. He's here because the clinical officers have been on strike. Today is the 10th day?
10th day.
The 10th day of a strike. These are clinical officers. These are the ones you find at level what and what and what?
You find us at every level. But majorly you'll find us in the 3, 4, 5. We run the outpatients, the inpatients, the specialized clinics, the theaters. We are the anesthetists, the cataract surgeons. We are the ones who give back sight to those people with cataract issues. We have many aspects. We have critical care. If you go to KNH today and the other referral hospitals, we are the ones actually who are taking care of the critical patients now, because the doctors are not there.
Okay, so let's go into this.
Yes.
The president said, look, guys, let's live within our means. There's no money. We can afford this much. Can you go back to work with that much, and then we shall tutafute pesa pamoja. Kipatikana tutapata sisi wote pamoja.
You see, if probably we were negotiating for more, we would be having a conversation. But for the interns, it is not that we're asking for more than they were being paid. Those who are already continuing were being paid the full salary.
How much?
What is happening is a reduction. The degree were being paid 115, now they'll be paid 50. For the diploma, they're the ones that they had not complied. They were giving them 15,000. And now they have taken it to 35. And that is why you saw the diploma a bit excited, because they feel it's an increment. But then it's not as per the PSC. And that is why we are saying that, can you pay them as per the PSC guidelines?
So what, apart from SR, okay, let me ask this question in a different way.
Yes.
What reason did the SRC give for reviewing this downwards? Is it that they were not aware of whatever was in existence with the scheme of service, with what had already been, what was already happening, that clinical officers on internship were getting paid 115,000? By the time they were coming with their advisory, let's pay clinical officers on internship 50,000 shillings. Was it for lack of knowledge of what was happening, Or did they come with a reason and an explanation? Was it a harmonization of interns in public service?
Yeah, I think there is a misunderstanding because number one, the interns in the health sector are not like the interns in the public service. And even if you look at the internship policy and for the Public Service Commission, there is a clause that provides that for the health sector, the Ministry of Health shall draft their own internship policy. So they actually acknowledge that there is a difference. But the second thing is that they are talking about increase in numbers of interns, which is actually lying to Kenyans.
Who's saying that? The SRC?
Yes, because...
So is that the reason? What I want you to understand
it's one of the reasons that I have heard, but from the document I didn't actually see the reasons. They were trying to say harmonizing across the sectors.
Okay. So the main thrust for the Salaries and Remuneration Commission was harmonization of the stipend for interns.
Yes.
In the public sector.
But what I heard from the chair, because she was somewhere yesterday, she was not talking about that. She was talking about the amount of money that is available and the fact that the number of interns has increased, which I'm saying it's misleading Kenyans. Because according to the establishment by the Public Service Commission, we have an establishment for 9,000 plus interns. We are only having around 4,500, half of that. So how can you then say that they are more than we expected when the mandated body, the mandated institution had given an establishment and we should budget as per those establishment? So what is happening is that somebody just wants to decrease the pay for our interns. They are looking for reasons elsewhere, which we are trying to say that it is very indignifying.
And are we saying that it cannot be pegged to the current issues which are being experienced? Because look, I dare say that indeed the government is broke.
I disagree.
That in order to have money moving around in the way it ought to, certain things have to have been done. Those things were not done. Whether you're talking about financial responsibility, financial prudence, etc. Because I hear you saying you disagree, obviously because of the kind of spending we are seeing in other sectors that doesn't make sense. Then you cannot then justify an inability or non-capacity to pay essential sectors in this country. So I can hear why you say you disagree.
Yeah.
But because of that action, that's why there's no fluidity of money. Because of that action, whether it is historic or present, that's why there is no fluidity with this money that we see should be going to these vital areas.
But allow me ask, we are collecting more taxes than we were collecting during Uhuru's time. Is that correct?
Yes, so we hear.
So we are told.
Yes. No, it is. We are being taxed more. Of course, they are collecting more because they are taxing us more. The other thing is that we are seeing budgets being increased, almost being doubled, like the office of the president, the State House, and many others. We are seeing the police having a presidential level task force and then their salary being increased by 40%. We are seeing the teachers having a presidential level task force and we are also seeing them completing CBAs and their salaries being increased. Why is it that when it comes to the health workers, then the issue of wage bill comes in? And that's why at some point, we feel like we are the bastard son in this government. Because the other sectors, they have CBAs. We wrote to the president because, by the way, as unions in the health sector, we have also sat back and asked ourselves, what is happening? Is there a way we can also contribute to the stability and providing long-lasting solutions for posterity? As I said, we don't like interrupting services. And we held a convention in 2022, a high-level convention. It was the resolution was actually read out by CS Chelugui when he was the CS for Labour. One of the things we agreed, and we discussed with the president in the Catholic University when he invited us during his campaigns, was we needed a presidential level task force that would sit and look at how do we manage our human resources so that we can ensure that it's effective and efficient and so that we don't have these perennial strikes. And we agreed that a presidential level task force would bring all the views together and would give us a pathway towards whether is it a legal framework, is it an institution like the Health Service Commission, what do we need? But then that did not happen. And when it didn't happen, we wrote as the Health Union caucus to the president and reminded him that we had actually agreed to do this. But then it didn't happen. We got a letter directing us to follow it up with the CS Health. But that has never happened. And that probably is one of the issues because we always push the government. It's not actually ourselves. The government always pushes the issues of health workers aside. And that is why they never get resolved. We are talking about issues from 2019. We have had return to work agreements. We have had strikes. And that is why we are saying this time round, we are doing it for posterity. And that's why we are saying we are not going back until these things are put on the table and we can actually resolve them.
Is there any CBA with any public entity that has been honored 100%?
Yes.
Which?
Ours with the Moi Teaching and Referral Hospital. It has been honored. That is the only successful one we have.
Okay.
We are in the process of now doing with KNH, and of course now the ones we are to conclude with the ministry and the Council of Governors. But why would somebody even sign a CBA they don't intend to honor?
So your CBAs with several counties and national government have not been fully implemented. We
have not actually even concluded the negotiations since 2019.
The doctors have a CBA, and among the issues that they're raising now is the non-compliance with the CBA.
Yeah.
Teachers have been raising issues since time immemorial, since Moi days, Ambrose Adongo days, of CBAs not being fully implemented, and so on and so forth.
Yeah.
So CBAs appear to be a point where you go in, you negotiate, you pull, you push, you sit down, you sign something. And it says this also comes with a return to work formula and a normalization of industrial relations.
Yeah.
You go back to work and the CBAs are not implemented. And so this forms now the excuse or the reason for the next strike. What should be the long-lasting solution to this?
Very good. And your analysis is very correct. Who is at fault? Of course, the employer. Because we negotiate openly and we agree and we sign. Because even we have had so many return to work agreements. There are things that we agree. But then what our employers usually, and that is why we had an issue with health being led by political entities. For them, the only interest is to see you at work, not to resolve and that is why they will go to court. They'll get a court order. Once you're back to work, they don't comply with anything else because they achieved what they needed.
Which was to get you back to work.
Yes.
Okay.
So for us, the long term, and especially in the health sector, as we have said, we have proposed a health service commission. And we actually give them a framework for a health service commission that sits in well with devolution. We said, can we have this type of commission which recruits from a requisition of a specific county? Murang'a County says, I need 10 dermatologists, I need 10 anesthetists, then sends to the Health Service Commission. It recruits and sends them there, and then they can delegate the management of those workers within that county. They can be deployed to any station. They can be transferred, but not outside. If they needed to move from a county to the other, they go back to the commission, they can go to the next county. But the management of the health workers will be within
the county.
That county. The governor said, we don't think it's a good idea. But then we're asking them, what is a good idea? Because we all agree there is a problem. There is a problem with the management of the human resource. And that is why we said, if we can have a high level, a presidential level task force, then we all bring these challenges and our proposed solutions to the experts. They can look at the issues and they can give recommendations, because what we need is not a commission. What we need is not whatever else the people are saying. What we need is effective management of human resources, one that ensures that there is parity of treatment across board.
Okay.
Yes.
So you've sat with William Ruto, the candidate and deputy president.
Yes.
And even signed a charter, right? And
We
an
didn't sign,
agreement.
but we presented him with a
but you had a long
memorandum.
conversation.
Yes.
Presented a memorandum and had an agreement of some sort.
He actually said we should keep photos and use them to remind him.
Bas. He gets into office and becomes president.
Yes.
And among his primary agenda is universal health coverage.
Yes.
He immediately embarks on rolling out universal health coverage. Let's have legislative framework in place. Let's look at the institutions that are managing health. Let's have all this conversation. The medics remind him of what you had agreed of a national task force to look at this matter. He delegates it to the Ministry of Health. It takes a while to happen. Meanwhile, bills are drafted, bills go to Parliament, bills are enacted, the President launches universal health coverage, and it's a systems go on matters, and even budgetary allocations are starting now to take shape in UHC format. But the matter of health, human resource for health, is not being addressed.
Yes.
Why do you think this is so? Because like I've said, it's not that the President is not aware
Of the issues.
of the issue.
True.
So why do you think President William Ruto is not pushing for the proper addressing of the human resource for health?
I think I cannot speak for him, but let me say that I also don't understand. Because number one, if you look at the components of an effective health system, which you need to implement universal health coverage, the human resource is the central pillar that holds all the others, be it the governance, the financing, the essential drugs, the information technology. The human resource is the central pillar. So whatever you do, if you don't get it right with the human resource, motivation, adequate staffing, and of the right skill mix, not only one cadre, don't only talk about promoters, talk about a skill mix. And you know, because it's good that we tell each other the truth. As things are now, we will not be able to implement the universal health coverage. From the analysis of the ministry itself, there is no hospital that, no level 4 or level 5 that is even working at 50% of its capacity right now. Why? We don't have staff. For clinical officers, right now, for the basic implementation of universal health coverage, that is to ensure access everywhere in this country, to ensure there is that quality. Quality means that I can actually make the right diagnosis, and that comes with the equipment, the lab, and whatever else. And, of course, to ensure that the affordability, we need 24,000 clinical officers employed in the public health facilities in this country. How many do we have now? 7,000. We have a shortage of 17,000. Are they available if the government wants to employ? Yes. We are 32,000 clinical officers in this country. They're actually available. And so that's why I'm saying we like pushing the issues of health workers aside. And sometimes we also don't understand. And that is why we also want to have this conversation with the leadership to understand what is happening and why we cannot just get it right. But I think the bottom line is that this country has never understood that you will never attain economic success unless you get it right with health. Because the money we lose as we seek for health care services elsewhere, we treat complications, is money that should have been put into investments. The millions and billions we are taking to India, how many factories can that make? How will it be able to expand the tax base? How many people will be employed in the investment that this money would actually be used in?
I disagree that this country does not understand that. I disagree. And I look back at William Ruto's key pillar, one of the 5 key pillars,
Yes.
is UHC, health. Uhuru Kenyatta's big 4, UHC, health. among the programs that they embarked on as Jubilee administration in term 1 was matters of health. Looking at Linda Mama and looking at even the First Lady's initiative was on health. So the issue of those in leadership understanding the importance of health and the burden of health and the importance of a healthy nation for economic prosperity, we cannot say that they don't understand. They do. They have demonstrated that they can see what the issue is. And that's why I come back to the question. What do you think is the reason why we are not addressing the issue of human resource for health when we are addressing everything else? We can bring in contractors to supply equipment to hospitals across the country, but we will not address the issue of the human resource that's needed to operate the equipment. We can talk about revamping KEMSA so that drugs can flow to the hospitals, but we're not talking about the people who will be needed to diagnose and to dispense the medicine. Why do you think this is? You talk to these people on a daily basis.
Politics.
What's the political angle here?
And
the political angle is this. And one governor once told me, if I employ 20 clinic officers, none of my constituents will know. They will not clap for me. I will not get a vote. But if I go and maram that road, everybody will come there and clap and I'll get a vote. And that is the problem. And they understand the need. That is why it is in all of their manifestos, because you want to appeal to that voter. But then when they come in, because our politics is quite superficial, I must say, and our people do not analyze things. So then for them, they want to do what can be seen out there. I've brought in a machine, and now you can do this. And of course, there is the issue of the kickbacks and the tendering and whatever else. There is no kickbacks when you're employing people. So it's actually the politics surrounding it. And I think at some point, we should separate the healthcare from politics. We should ensure the management of healthcare services is done like in the military. In the military, there is no politics to it. The CS does not actually determine much. We should have the same structure in the healthcare so that it can actually run even when you don't have a political appointee and there will be a budget. Why is it that we budget for employment of soldiers every year, those in the army, the police officers every year, but we cannot budget for employment of health workers every year? We all understand that these are an essential service, as Ndu says. We understand the suffering of Kenyans. We understand also what it can do. We say every Kenyan is just one disease away from poverty.
Yep.
Right now, if we can have proper screening of cervical cancer, if we can have proper vaccination of our girls who are in the ages where we can actually prevent that infection by the HPV. Do you know in 20-30 years, the burden probably will come down more than 50% or probably 75%. How much money are we using to treat just the CA cervix alone?
Yep.
But in our politics, we look at short-term solutions. We are looking at, I'm only here for 5 years, I'm only here for 10 years. You only want to do something that people are going to say that you have done that is only going to benefit us within the period you are in office. We don't do things for posterity. And that is the problem, I think, with the health sector. They see health workers as a liability. But we have actually been trying to convince them you should look at health workers as development. And I talk this in the context of the PFM Act. When you're talking about recurrent not going beyond 35, because that is what many counties will tell you, that we have exceeded the ceiling. We cannot go beyond. But we are saying, can we transfer health workers to be a development aspect? Because we are actually part of the development. We help the nation save money so that it can invest. And then we can be able to employ every year. I don't see the reason as to why we cannot be able to employ every year so that then Kenyans can be able to access that health care. We don't have to spend so much money in the privates and going outside country to get those services.
What's the barest minimum in terms of what needs to happen to get clinical officers back? I'm not even talking about whether it is now a strike in solidarity, whether it's a strike on its own, and now everybody has essentially joined hands. What's it going to take to get clinical officers back?
I think number one, all our demands are very important. And they affect our members. But I think what we have said and agreed with the ministry, there are things that we can agree to do and the others we can continue talking while we are at work. The enhancement of the risk allowance, the conclusion of the CBA, and the reason as to why this is bare minimum is because we don't have another option. In fact, now we are the ones who are trying to help the court. Because even the court has not been able to bring them to the table. It's only a strike that can be able to do that. The universal health coverage staff, even if we are going to be on strike for 10 months, they must put the universal health care staff on permanent and pensionable. We must create a tradition in this country of appreciating people who sacrifice on behalf of the country. The interns must be paid at their rightful job group. We want Kirinyaga health workers back. We want an end to contractual employments in the counties. And we also want clinic officers employed and all the health workers actually, not only clinic officers, all the health workers in their right mix because we don't work alone. And we have a framework to employ them every year. If we can agree on these things and create a structure, then we'll do a return to work agreement and the other things we can discuss as we proceed. Yes.
People are sick today.
True.
If you look at the story that I was looking at here in the Standard today, it's actually telling the stories of people who are in hospital, those who've had to leave public hospitals, go and seek services elsewhere in some private facilities. They cannot afford that. Some have gone back home. They're sitting back. Somebody is looking at their sick loved one at home, knowing they have no way of helping them. What do you tell those people?
I think what I will tell them, I will start by saying we are sorry as health workers. And number two, I will tell them that your government, the leaders who you delegated your power to them and gave them your vote so that they can ensure you get your rights, they have failed you. They are the reason for this strike. We wouldn't be on strike if it was not for the contempt by the governors. And so they are the reason for the strike. So I want to ask them, as responsible Kenyans, please ask the people you sent to office to carry out their mandate, to be responsible citizens, and to obey the court orders. If they had come on the table, those people would not be suffering. But please allow me to also address His Excellency the President. I know he must be, sometimes I'm sure he might listen to this. Your Excellency the President, we met, we discussed. I am actually the one who handed over the memorandum. We had an agreement and a very cordial conversation on how we were going to make health work in this country. We still believe that in the things we agreed, we can be able to bring stability, we can be able to deliver universal health coverage, but we must make deliberate and bold decisions and investments in the healthcare to ensure that this happens. As health workers, we are ready. We are not interested in strikes. Please put together the presidential level task force that we discussed so that it can look at the long-term solutions. But in the short term, please intervene to ensure that this crisis comes to an end and that we also don't lose, that no side loses, that the unions get what they need and the government get what they need so that the patients cannot suffer and can continue getting the benefits they ought to get.
Message to President William Ruto from Peterson Wachira, National Chairman of the Kenya Union of Clinical Officers. Thank you, Peterson, for joining us.
Thank you.
And thank you for tuning in to Kenya's biggest conversation. Have a lovely day.
This is the Situation Room, the only way to start your day.